was really a cool looking snake. I mean, probably not what you want to see, but it's very cool looking and kind of interesting. This one is one of the most frequently encountered venomous snakes in Vietnam. So people see these often. Doesn't mean they're bit as much, but they see them and come across them. And they, some sources were saying that the Wagler's pit vipers were the ones that tourists would be bit by. So, because of where they are. So, they're kind of in these lush green expanses and forests, and people going on rainforest tours and kind of more touristic things, they're seeing these Wagler's pit vipers and coming in contact with them. If you're bit by a Wagler's pit viper, their venom is pretty, the cytotoxic effects are really aggressive. So there's a lot of cell death and tissue death at the site of the bite. So it will be extremely painful for patients. You get this burning, swelling, and then necrosis on the area of the bite. So these bites, even if they just release a small amount of venom or if people survive them, there's a really high likelihood of an infection after the bite. And, that's kind of the case for all of these. Once you survive them and you're out of the woods of death, you really have to tend to the actual site of the bite because there's so much cell death in the area. It's really predisposed to becoming infected because when the cells die, then you can't get good white blood cells or other cells that would help immune cells to help the healing. You can't get them to that area, or you can't get antibiotics penetrating that area because of the cell death. And so infection is a really huge risk, secondary risk for death and illness with snake bites. And then again, kind of what I was saying, the venom isn't as deadly. There's some neurotoxic effects, but it's not as potent as, say, the king cobra or some of the other ones we've talked about, or the crate. But if you are bit and there's a high amount of venom released, or you're really far from the hospital, it could be potentially fatal. So with these ones, there is a multivalent antivenom, and it's created for all species of kind of green pit vipers. They're close enough to each other that you can give that same antivenom. So the white-lipped viper, and this one, again, a really beautiful snake, but pretty dangerous, but it's very, very pretty, I thought. The white-lipped viper are adaptable and can be found in a multitude of habitats, including shrublands, rural gardens, forests, and then even populated by humans. So because they're so good at being in any environment, that's why they're one of the more deadly snakes, because you just see them in lots of places. The venom is cytotoxic, so it causes this localized pain, swelling, and necrosis. The localized tissue destruction can lead to gangrenous infection. So kind of what we talked about on the last slide, just like a lot of these bites because of the cell death at the site of the bite. The venom in the white-lipped viper is hematotoxic, so it contains a procoagulant. So this will actually, because it's a procoagulant, it will help like form clots. So you could get clots and then be throwing clots everywhere. And get this like intravascular coagulation. So it thickens your blood, which can lead to cardiovascular collapse and then death as well. You treat the bites like, with supportive care, and then give that multivalent antivenom for green pit vipers, because green pit viper as well. So that kind of is the snakes I found in Vietnam. That, there are a few others. I talked about the 9, but those were kind of the main ones that you see and then are interesting, and the other ones are much more rare, and so it's going to be rare to come across that bite. These now have a few from the United States, and part of it is just wanted to share what we see. And if you find yourself here and visiting, and a lot of these are actually in Utah and the surrounding area, so when you come visit us and do some work here, you'll know what to look out for if you go on a hike. But this is the eastern diamondback rattlesnake. And they are the most deadly snakes in the United States. So if you're bit, you have about a 30% chance of mortality. That's even within the United States, and having access to antivenom. They're usually in the southeastern United States, but they can come as far as Utah. The venom has a crotolase, which is a thrombin-like enzyme that leads to activation of plasminogen. And then that reduced platelet count, and then you get hemolysis of red blood cells. So lots of bleeding. And then there's a phosphodiesterase. So it stimulates the release of bradykinin, which results in severe pain as well as hypotension. And both of these things can lead to death. The rattlesnakes, we do have an anti-venom available, and it's kind of it's for all the rattlesnakes. And similar to what, we were talking about before the lecture to you guys, we don't have it available at every hospital. It's really like a regional medical center thing where most people will have rattlesnake or snake anti-venom. And so got to be specific with figuring those things out if you're triaging a patient that's been bit by a snake. This is the Western diamondback rattlesnake. And so it looks really similar, has really similar properties. It's just found in the more western, southwestern parts of the United States. So this is definitely one that we see here in Utah. It contains kind of similar things. So it has that hematotoxin, just like the Eastern diamondback, where you'll get massive bleeding. And then it has these proteolytic enzymes that will cause local destruction and necrosis. The Western diamondback also has cytotoxins and myotoxins. So you get the localized cell death, and then you start to get this myotoxins, you get severe muscle breakdown, and that can lead to rhabdo, and then kidney failure and cardiac failure as well. And then it also has features that prevent muscle regeneration. So it makes the recovery long and really difficult. And it's just, even with the anti-venom. And then this is the Mojave rattlesnake. So again, they're all very similar here in the United States, and they're not as colorful, and they're much prettier in Vietnam. So this one is also in the southwestern United States and kind of more in the desert areas. These bites, this is similar to some that we talked about, but people sometimes don't know they were bit because it's such a subtle little bite at the site of the area. But the venom is pretty toxic. So it's neurotoxic, which we talked about when things are neurotoxic and they make it so that your respiratory muscles are paralyzed and can't breathe, and that is what would kill you. And then there's also some hematotoxins. So those, and then here we have the cottonmouth. And I put this picture in the United States. This is kind of the stereotypical person that we think of when we think of snake bites. The situation here is a little different in Vietnam. Sometimes it's living situations, sometimes and maybe you have some of this, but here in the United States, people will collect these venomous snakes. They try to have them as pets. They buy them when they're young, when they're little, and then they grow, and then they bite you, like this guy. The cottonmouth, the venom is cytotoxic, and so it just causes a lot of severe pain, swelling in the area. And then this one is one that leads to amputation a fair amount of times. So here is copperhead, again, kind of that brownish dark color. I think this is the last US one, but this is in eastern and central United States. And this one typically is a dry bite, so no venom is released. It's really if it would gonna bite you twice or a second person if you're walking together, you would get the cytotoxicity, but also nausea, vomiting, and then some bleeding and diaphoresis, become tachycardic and hypotensive. A lot of that's from the bleeding. And this one is usually self-limited. There is an anti-venom for copperhead, but it's not great. It has a lot of side effects. So they actually don't always recommend the use of it. So kind of just some general things about snake bites that wraps up the specific snakes, and just a good review. What I would always say is if you can ask the patient if they have a picture, if somebody took a picture, or maybe they are really familiar with snakes, and find out what snake it is. If there's a suspicion of a snake bite, it's really imperative to know what the bite was, and then the duration, how long has it been. So you got to make sure if you're in the pre-hospital setting, get as much information while being safe yourself. Like, don't put yourself at risk of like taking a picture of the snake if it's going to bite you as well, obviously. So get a picture, but make sure the patient rescues are in a position of safety, and then just kind of keep the patient calm, monitor the vital signs. But what I say is, like, keeping the patient calm is probably the most important thing you can do at the site or before they get to the hospital, because if you can keep the heart rate down, it actually is going, once the venom gets in the blood, it's going to circulate. And if the heart rate is down, then there's less circulation of the antivenom. So keeping the patient as calm as you can, just like nice and relaxed, it can maybe slow down how quickly the antivenom takes hold. And so it's a time like people are going to be freaking out and very nervous, but keeping them calm. If you can put an IV in, you can start fluids. Fluids can help prevent any hypotension. They can also help kind of just disperse the venom a little bit. If you need to, start oxygen. And then immobilize the affected area. So if it's usually going to be like an arm or a leg, so totally immobilize it. So put it in a splint, and part of that is just to like delay any movement of the venom outside that area. So if you keep your arms still, theoretically the venom's not going to spread as quickly. So that's the point of that. It's just to prevent the venom from getting into everywhere throughout the body. There's some like these negative pressure suctioning devices that people have for snake bites. And so it'll like, you put it on immediately after the bite. If you suspect a envenomation, you would put it on immediately after and then suck up as much as you can. There's been shown to be some benefit to that, but it has to be used immediately after, because the venom is going to spread out of that like site pretty quickly. And then don't ever make an incision over the bite. Don't ever use your mouth or somebody else's mouth to suction it. Then the venom's going to go into you. It's not effective. Don't apply tourniquets, ice packs, electric shock. The only thing I would say, the only stipulation to the tourniquet rule is that if you are really remote, you're somewhere where you're hours and hours from healthcare facility, where say you're 6 hours from getting somewhere and you've been bit by like the Malayan crate or king cobra, something that's extremely toxic, extremely deadly, and it is within 20 or 30 minutes, you can apply a tourniquet and know that you're going to lose the limb. So if you're bit on the arm, you put the tourniquet on thinking maybe I'll save this person's life, but they're going to lose their arm. The effects of the tissue is going to be so severe in that area, but it's kind of a last ditch effort while you're trying to get the patient to the hospital. So if you're pretty confident that they were bit, it's a venomous bite, you're really far, you can try a tourniquet. But if you're anywhere remotely close, don't put it on, because you're just doesn't help that much, and you're going to kill, they'll lose that extremity. So I kind of put this in here for you. It was kind of an interesting thing, but it's just a little kind of board that you can look at. And I don't need to go through this because we kind of talked about it, but these reiterates some of the things that we talked about, like reassure the patient, keep them calm, immobilize that arm, go to the hospital and tell the doctor and try to figure out what the snake bite was. The other thing, like find out the hospital. So if you have med control, if you have any ability, like make sure your EMS or make sure anybody who's providing care pre-hospital knows which hospitals have anti-venom. If you're working in a city and one hospital doesn't, it's really important. And you want to, like, people need to know where to go and where they would be able to find anti-venom, because it's going to waste a lot of precious time if they go to a hospital that doesn't have anti-venom, and then you have to transfer them to the other hospital. That could be the difference between life and death. So making sure everybody knows which hospital has anti-venom. And then these are kind of just these effects of it, which is nice, like king cobra, ambiguous, or other species, and like what species it may be, because it's important to identify the species. We're not going to talk a ton about the specific antivenoms, because if you're seeing the snake bites, you're going to know what to give. And then if there's any question or concern, you can always call your toxicologist if you have that available, or a poison controller, there's somebody you could call to say what is the specific antivenom for the snake. So when the patient gets to your ER, you're like, okay, I was bit by a snake, or they were bit by a snake. The first thing is going to be your, ABCs, or airway, breathing, circulation, just like every sick patient that we see. And airway is huge. If anybody has droopy eyelids, they're having difficulty with their speech, they're having difficulty swallowing, this is an indication that they've been bit by something that's neurotoxic, and it's going to cause some level of paralysis. If you're on the fence, or they look suspicious at all for having severe illness with this, then you're going to want to intubate them. And remember that the antivenom isn't going to reverse. Almost in every case, the antivenom is not going to reverse that paralysis, and it could get worse. So if you're worried at all, then you want to mechanically ventilate them. So intubate them and then mechanically ventilate them. Because, as a side note, because they're on some of these snakes, if you're not totally familiar with all the specific things of the snake, you're safer to use rocuronium if you use a paralytic, and not succinylcholine, because succinylcholine, remember, can cause a release of potassium. And if something is causing destruction of the muscles or cells in the muscles, or causing muscle breakdown for a snake bite, you could get a release of potassium. So I would avoid succinylcholine and use rocuronium or vecuronium or one of those other paralytic agents in a snake bite if you're intubating them. And then once they're stabilized, make sure that your hospital has antivenom. If not, get them to a facility that does immediately. And then fluids, these patients might be really hypotensive, so fluids. And then if you need to use pressors, so I would just use epinephrine or norepinephrine in this case, like a push dose pressor, just to make sure their blood pressure is up. Initial labs, I would get a CBC for sure, and peripheral smears, the PT, INR, and a PTT, fibrinogen, and all those tests are just to see if they have destruction of the clotting cells. Type and cross them because they may need blood products if they're bleeding from some area from hematotoxicity of the venom. CMPs to look at their kidney function, urinalysis if you can, and then blood gases, lactates, chest x-ray to look for pulmonary edema, as that can be frequently found in a lot of these bites. And then you want to make sure you get an x-ray of the site of the bite, and that's to look for any retained fangs and or any breaks of the bone. It'd be pretty rare for a snake to bite and like fracture the bone, but they can. If you pull your arm away, you can end up breaking a fang off inside. So you want to make sure that's not the case, because the fang could be continuously producing or releasing some venom, and then also can lead to worsening infection. Not maybe immediately, but pretty quickly, you need to be aware and do checks for compartment syndrome, because there's just so much tissue death and swelling at some of these snake bites that you need to just do continuous checks for compartment syndrome. All snake bites, in addition to the antivenom, would get Tdap, so tetanus, as well as antibiotics. And then there is a severity score for snake bites, and this can be helpful, especially if you're talking to a toxicologist, poison control, maybe in Vietnam that's the government, like whoever is going to help you with the management of this case. And so here's the scale, and it's something you can always like look up or look into. And it's going to classify snake bites into minimal, moderate, and severe. So minimal probably is a dry bite, so one that isn't producing any venom, and then it goes all the way to severe, and you can get the score as high as 20. So depending on the severity of the score, depends on how much antivenom you might need, and then the risk of death. So when you give antivenom, when you have it, and this kind of is across the board for most of these antivenoms, you're usually going to start with 4 to 6 vials, and it's not dependent on the size of the patient. It's dependent on the severity of the bite. So the severe bite, you're going to just start with 6 vials, and then you observe the patient for an hour after the first 6 vials. If there looks like things aren't worsening, they're not, you're usually okay. But if the symptoms are still progressing, then you want to give another 4 to 6 vials. And then you would continue to do that until, like every hour, you continue to do that until you see kind of at least the symptoms stop. um, progressing and not getting worse, and your patient kind of stabilizing. So anti-venom is usually safe for children. I know you can see most adults, but just so you do know, it's fine for children. I mean, it's really a life-saving measure, so you're going to give it really no matter what. And it controls the local effects, hematotoxicity, but not neurotoxicity, which we've talked about a few times. So the neurotoxicity, those fasciculations, the ptosis, the difficulty breathing, you still need respiratory support. You still need mechanical ventilation for these patients. And then if somebody's been bit somehow and they know that they're allergic to antivenom, which that would be terrible luck if you've been bit multiple times and you're allergic to antivenom, but you can dilute it and then you can give it with epinephrine. And I'd probably give it with a dose of steroids and as well, but I hope that is not the case. It would be a very unfortunate situation. So moving on from snakes, I really only have one spider from Vietnam to talk about and one plant, but they're kind of the deadliest, most common. So this is the yellow sac spider. Don't know if any of you guys have seen them. Not gonna lie, I don't love spiders. So this was hard for me. Snakes I like, I don't know. Spiders scare me a little bit. But this is the yellow sac spider, and it's the most common venomous snake in Vietnam. It's not that deadly. It really hasn't, I don't think it's killed anybody documented, but it's so common and it does release a little bit of venom. And so that one you should be aware of, as you may see a patient that's been bit or come in and with something else and you figure out that that's what it was. But they're found in jungles, outdoor garden areas. They're pretty common in Vietnam from what I understand. The bites usually lead to local tissue necrosis from cytotoxins. So the cells, cell death in the venom. And then they can cause systemic symptoms. You can get headaches, nausea, vomiting. They're usually pretty mild and self-limited. They're obviously going to affect children more because, if they produce the same amount of venom in a smaller person, it's going to cause more of an effect. And then they can cause more severe symptoms in people with really serious chronic medical problems. And that's when you may see them come to the hospital, as opposed to just being at home to deal with them. There is not really an antivenom. The care is just supportive. So you're just going to treat them supportively and then look out for infection because of that tissue necrosis with the cytotoxins in the venom, then you really are going to look out for infection. Probably common that these bites get infected after the fact. And again, that might be something you do see in the ER, somebody coming in with a bad infection, and the initial nidus for the infection was a yellow sac spider bite. And the plant is this one I found, and somebody can maybe help me with the pronunciation, but Le Nagan, and it's also called heartbreak grass. And I saw it when I was looking at plants, like just fascinating plants, because we have a few here in the US that are pretty deadly. And this one came up time and time again, and kind of a fascinating plant that is pretty common in Vietnam. It looks beautiful and it can be mistaken for other things that people use. So they will often mistakenly pick it and put it in soups or salads. And it's very deadly. It has these strong alkaloids, so it's really alkalotic, and symptoms can appear within 5 to 30 minutes after eating or drinking it. And you can get these dilated pupils, ptosis, double vision, decreased vision, dry mouth, dysphagia, dysarthria, bradycardia, dyspnea, respiratory failure, headaches, dizziness, weakness, seizures, and paralysis. And really, really pretty quickly. They said that it would only take like 2 or 3 plants to kill an adult, like 2 or 3 of these leaves that could possibly kill an adult. If you have an idea that you ate it, or somebody ate it, then you should probably try to induce vomiting. You can give activated charcoal. Otherwise, the care is supportive. And this got some news worldwide, this plant, because there was a Russian diplomat that was in jail that died, and it was found out they found the toxins from this grass in his blood. So he was poisoned by somebody with it. And it is something that people use criminally to poison others. Like I was looking, it's pretty common. So kind of an interesting plant and one that I was glad to I just show you guys in your life if it's not something that you've been taught or you're familiar with. It's something that looks so benign, but it's pretty toxic. So I guess you should be careful for it. Um, but yeah, that's what I have today. I didn't do any questions because it's kind of a really broad topic and, just something that I was hoping that you guys could maybe tell me stories if you've seen any of these or seen patients with these, obviously. Have you said thanks? Okay. Yeah. Well, I read about it for this. Yeah, it was good. Uh-huh. Yeah. 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 Yeah, I saw that when I looked at it, it came up a lot, like in the Vietnamese news, that there was three people that died because they put it in some soup and they like mistakenly. Yeah, yeah. Nice. Any see any snake bites? Have you guys? Yeah. Okay. Hmm. Yeah. Hmm. Yeah. Yeah. Which snakes do you see the most? The green ones, yeah. Uh-huh. So, yeah. Hmm. Oh. Hmm. Yeah, no, I'm interested because when I try to look up the anti-venom in Vietnam, it's just hard. Like not that much was coming up from Google US because they're like, well, you don't need to know as much in Vietnam. So it's hard to find like the specifics of the anti-venoms, except for just that there was one for green vipers and one for crates and yeah, and one for cobras. Yeah, the multi, yeah, yeah, yeah. Hmm. Yeah, I did learn that. It looked like most of the venoms, anti-venom. Yeah, yeah. Huh. Well, yeah, of course. Yeah, thank you. Well, I'll be back in October. So I got a couple months without you guys, but I'll see you in October. And hopefully I'll get out there soon. Bye guys.
Thank
Thank you.
you. Thank you, Claudia.
Bye. Thank you. Have a good day.